Hello everyone. Today we'll be talking about asymptomatic bacteriuria. So we are going to discuss based on the guidelines given by the IDSA, that is IDSA 2019 guidelines on asymptomatic bacteriuria. It is defined as any patient who has in urine, there is something called as colony forming units. That means that number of bacteria or colonies which are formed in the urine per ml, we try to measure it. And in the urine sample, if the colony forming units are more than 10 to the power of 5 per ml, then it is called as asymptomatic bacteriuria. Usually this is called as bacteriuria, and suppose this occurring without any symptoms, there should be no symptoms. If there are no symptoms with colony forming unit of more than 10 to the power of 5, then it is called as asymptomatic bacteriuria. So many of time, this is why we need to discuss is that many of times we are not aware of the guidelines whether to treat this or not, and patients may be treated with unnecessary antibiotics a lot of time. So as a clinician, we need to be aware of it to how to treat this case. So on definition, as you have discussed, it is more than 10 to the power of 5 colony forming units per ml bacteria in urine without any urinary symptoms. Urinary symptoms will include like increased frequency of urination. It will be like abdomen pain or loin pain, any fever, nausea, vomitings. So all these things comes under the features of that. So for it to be diagnosed, suppose you have to diagnose in a female asymptomatic bacteriuria, there should be two consecutive voided specimens. That means that two urine samples has to be taken in females. Suppose you want to do it in the male, then one sample is enough. Or suppose you want to do it on a catheterized patient, a patient who have a Foley's catheter, then it should be single sample should be sufficient. So what are the indications for screening and treatment? The guidelines IDSS says that only there are three recommendations where the patient of asymptomatic bacteriuria should be treated. First is the pregnancy. This has been seen in various studies that pregnancy patients, even without symptoms, if they have colony forming units of more than 10 to the power of 5 per ml, if not treated, they tend to get a higher chances of pyelonephritis, and they can also have a preterm birth. So thus, based on this evidence, it is indicated in pregnant females that even if there is no symptoms, but if their urine shows the pus of more than 10 to the power of 5 colony forming units, patient need to be treated with antibiotics, that is 5 to 7 days. Second indication comes is patients who are going for any urological procedures where there will be mucosal tear. So you want to do some urological procedure where you are expecting a mucosal tear in those patients, then this patient has to be given 1 or 2 days prior. You have to start him on antibiotics, even without symptoms, because here the procedure is going to induce some damage to the mucosa, which can lead to the spread of this infection. So that's why in this patient it is recommended. Third is patient of renal transplant. So renal transplant recipient within 1 month. So we are talking only about within 1 month. So that means a patient has received a kidney and it has within 1 month it is there. And here this patient is found to have a colony forming unit in urine of more than 10 to the power of 5 per ml. Then this patient requires the treatment because it may lead to again a lot of infections because there is patient is under highest immunosuppressant at this period. Other than this, there are no other indications for the treatment. That means that if suppose a patient is non-pregnant or non-pregnant female, treatment is not required. Non-renal transplant patient, it is not required. Also in renal transplant patient, if it is more than 1 month, then also treatment is not required. Also in elderly patients or diabetic patients, eh, without any symptoms, you do not treat this, even if there is diabetes or elderly. Suppose elderly patient is having drowsiness or patient is under delirium, then also there is no indications for the treatment. Only treatment should be given when patient have a fever with asymptomatic bacteriuria or patient is having hemodynamic instability. That means that patient blood pressure is dropping or something like that. If it is there, then only you need to treat it. So coming to that, do not treat asymptomatic bacteriuria in elderly with cognitive impairment, patients with chronic catheters, asymptomatic diabetes is not required. Also avoid routine urine cultures unless clinically indicated. And indications, as we have discussed, pregnant women, patients undergoing urological procedures, renal transplant patient, that is also first month post transplant. And it is not recommended in healthy non-pregnant women, children, elderly or diabetics, patient with catheter, non-renal transplant, spinal cord injuries. Thank you.